I trust.
And I trust.
I trust Simply Nature.
Good morning, everybody. Welcome again to another series of Simply Healed with Simply Nature. And again, today, we are very honored to have our wonderful Dr. Joel. We are all familiar with Dr. Joel. His clinic is in Centuria Medical Center is J. Lopez Medical Group. And we are very glad to have Dr. Joel. The last time Dr. Joel was on our program, he had one of the highest viewers and ratings. So, Dr. Joel, we are looking forward to also another great session with you today. Good morning, Dr. Joel.
Good morning. How are you?
Good. Doc, today our topic is going to be on something that is so important to all Filipinos, which is diabetes. Okay? And for all our viewers throughout Asia, diabetes is a big issue among Southeast Asian countries. So today we're going to cover all the wonderful topics. We're going to try and finish everything in 30 minutes. We're going to take a look on the side here. These are the topics we're going to cover today. All right, we're going to talk about the myths of diabetes, the truth of what is sugar, and what's the best way to measure sugar. We're going to talk about diabetic drugs because a lot of us are on maintenance drugs, right? Metformin and so on and so forth. So Dr. Joel is here is going to give you a great idea of how drugs play a role in your management of diabetes, and how do you actually reduce all the complications of diabetes? Because people don't die from diabetes, they suffer because of the complications. And last but not least, Dr. Joel is going to show you how you can reverse your diabetes. So stay with us throughout this whole process. And the last part is the most important, right? How do you actually reverse diabetes? All right, so Dr. Joel, let's jump in. Could you start with the myths of diabetes? Because, diabetes is something that we all have, but we sort of hear so much about it. But what is the truth about diabetes? What are some of the myths?
Yeah, so there are many myths concerning diabetes. One of them includes that it is genetic. Actually,
not genetic?
You may have the risk to develop diabetes. Mm-hmm. However, the environment could actually influence the expression of these genes.
Oh, wow. So it means that, what about type 1 diabetic? I thought type 1 diabetes, you can't avoid it. If you have it, you have it. So it's possible that you have it, but it doesn't get expressed?
Usually the type 1 diabetes could happen in those babies who are actually exposed to cow's milk.
Oh, wow, really?
Yeah. So not every baby develops this though, but there are those who have this, similarities in the genes.
Okay.
Yeah, between the pancreas and the milk.
Mm-hmm.
So basically what happens is that the immune system begins attacking the pancreas because of its similarity to the cow's milk. So yeah, that's one of the possible causes of type 1 diabetes.
So the first myth is that diabetes is actually, being genetic is actually not really completely true?
Yeah, exactly. Wow. Yeah, and our genes are like the barrel of a gun. All right. And the environment is the trigger.
Oh, okay.
Do you get what I mean?
I get what you mean. So it means that you could load the gun and never shoot it as long as you don't pull the trigger.
Yeah,
so
exactly.
You carry the genes for diabetes, but you never will develop diabetes if you don't have the environmental factors that switch it on. Epigenetics, right?
Epigenetics, yeah, that's the term.
Wow.
Yeah, right. Yeah. So our environment really influences how we express our genes. So if we're on a pro-inflammatory diet, then a lot of these genes that we don't want to express, like the ones for, let's say, for cardiovascular disease or for diabetes, then
We can avoid it.
yes, exactly.
So the good news about this, busting this myth that diabetes is genetic, is that it gives control back to you.
To the
Right?
person.
We can decide whether or not we develop diabetes. It's not our genes that decide it. Wow, that's control back to us. Wow.
Yeah.
What other myths are there in
So,
with regards to diabetes?
yeah, the second one is that we're taught in medical school that diabetes is not reversible. However, in clinical practice, we see a lot of this. So, yeah, sometimes people just lose weight and their blood sugar improves. Some people go on a whole food diet and their blood sugar improves. Some people exercise, which improves insulin sensitivity, and that also could reverse their diagnosis of diabetes. So there are a lot of things that could actually help to reverse it. In fact, there's a doctor from the States. He just has his patients go on a raw food diet for 2 weeks,
Oh,
and
just
that would help. Yeah, it
wow,
would
that would
actually
help.
help improve their blood sugar.
Wow. So, myth number 2 is busted. You can actually reverse diabetes.
Mhm.
Wow. I mean, I was asking Dr. Joel, Doc, then why do diabetologists and doctors think that diabetes cannot be reversed? Because that's what we often hear from them.
Yeah, that's what we're taught actually in medical school. But in clinical practice, we see diabetes reversed again by
Wow.
making some changes in diet or lifestyle.
Wow. So it's really a difference between theory and on the ground experience.
Yes,
So
exactly.
in theory, we were taught in med school, it was taught that diabetes couldn't be reversed, but on the ground, we've seen patients actually reverse and recover permanently, right?
Hmm.
They're not reliant on drugs to be diabetic free. They are actually back to normal.
Yeah.
Wow, I think reality is more important than theory. So that's good news.
Yes. And actually, science keeps on changing sometimes. Like, for instance, like 30 years ago, we were told that nerves do not regenerate,
Okay.
but now we know that it does.
Well, that has much implication for stroke patients and
Yeah.
patients with paralysis, right?
Mhm.
Wow, that's good news.
Yeah, that's where things like hyperbaric oxygen therapy or cell therapy comes in.
Wow, that's great news.
Yeah.
Well, Doc, back to diabetes. What other myths are you going to bust today?
So people think that pre-diabetes is a problem only if it progresses to diabetes. But
Okay.
actually, pre-diabetes has a lot of ongoing pathology already, so it needs to be addressed.
Wow. Okay. So this means that you don't just ignore if you're borderline diabetic, don't ignore it, right?
Yeah.
So it means that just because you're borderline diabetic, diabetes is not the thing that you should really just worry about.
Mhm.
It's actually starting you down the road to all the way, I believe, to cancer, right? It's
Mhm.
like a precursor.
Yeah.
Yeah.
And the sooner you actually treat it, the better. Yes.
Wow. That's yeah. Get it done tonight. Today. So watch this whole video because the last part, that's what you want. How to reverse your diabetic symptoms and your condition. Hallelujah. Doc, any other myths?
Yeah, so people think that lowering blood sugar prevents cardiac events and reduces mortality, but it is not so because according to one study called the Accord study, so strict blood sugar control actually may still cause an increased incidence of cardiac events.
Oh,
So even if your blood sugar, let's say, has been within the normal range, people could still develop heart attacks or hardening of the arteries, especially if underlying pathologies or risk factors are not addressed. Like, for instance, if there's chronic inflammation or if there's oxidative stress, and these are not addressed in diabetics, then they could develop more complications.
wow. So what you're saying, and to all our viewers out there, is if you're diabetic, if you control your blood sugar, you're not removing the real damage of diabetes. So it's an illusion, right? So just because your blood sugar is normal, it doesn't mean that all the risk of diabetes, which is a heart attack and all that is still there. All you are doing is numbing the pain, sort of, right? You don't feel the pain, but the wound is still there. Is that a good analogy for what you're sharing?
Yes.
All right, that's great. Wow, powerful today, powerful. What else, Doc?
Yeah, weight loss is necessary for reversing diabetes.
So it's not.
It's not.
Wow! I'm sure there are many audience right now jumping up on their chair and clapping their hands.
Yeah, it's about improving your body composition.
Okay.
Yeah, so people need to increase their muscle mass and burn more body fat.
Okay, so we
not
still
just about
can't eat
losing-
potato chips and sit on the couch.
Yeah, because some people do lose weight, but they lose muscle instead.
Okay,
Yeah, and when you do that, it's harder to burn off fat.
right.
You lose your muscles.
Okay, so calm down, everybody. Dr. Joel is not giving you the permission to be fat. If you're
Not
diabetic,
just-
you have to get healthy. All right, you gotta get healthy. All right, Doc, is that all?
That's so as far as it's concerned.
Wow. Okay, great. So now you know the myths of diabetes. It's not just it's not genetic alone. That means you have control whether you develop it or not. All right, and the rest of the myths all has been busted. So now we'll move on to the next topic, sugar. Because if we talk about diabetes, you cannot avoid sugar. So Doc, can you give us a lowdown, a brief about the truths about sugars?
So with sugar, it's actually harmful. It's
Okay.
one of the things that I learned from a few of my mentors.
Okay,
They say that white sugar especially is poison.
it's poison. That's a
Yeah.
very strong word.
Yeah.
Poison.
And it's
Wow.
more addictive than heroin.
Sugar is more addictive than heroin. All right. Wow.
So
Okay.
people do crave for it. But again, it's something that's legal, so everybody has access to it.
So is muscova sugar like healthier? I mean, are there sugars that we can eat?
Yeah, there are better forms of sugar.
Okay. So
Yeah,
give us a
that's
briefing
white
on
sugar.
sugar.
Yeah. But anyways, sugar in general is inflammatory.
Okay.
Yeah, it also suppresses the immune system.
Mhm.
It does suppress hormones as well. And it's generally acidic in nature.
Mm.
Yeah, so when you have high blood sugar, you have increased secretion of insulin.
Okay. So if we are to eat sugar, what is the less or least harmful types of sugar that we can take?
There are people who could actually take alternatives to sugar, such as stevia.
Stevia. All right.
Some use xylitol,
Okay.
and some use, of course, unfiltered honey.
Honey. Okay, honey. All right.
Yeah.
So it is. What about muscova? I mean, brown sugar. I mean,
Brown
now
sugar.
is it really much better than white sugar, or is it like we're just fooling ourselves?
Supposedly better than white sugar, because
Okay.
it's less refined.
Okay.
And there's also something called cocoa sugar from coconut.
Yes.
Yeah, I haven't studied much about it, but it's supposedly good as well. A good
All right.
alternative.
But stevia. I mean, we had so much concerns with artificial sweeteners like aspartame, which
Mhm.
turns out to be carcinogenic, right?
Mhm.
So is stevia safe, or does it also have all the concerns of the other sugar replacements? Is stevia a safe replacement for sugar?
I believe so. It's something that's natural compared to the synthetic sugar alternatives, which, by the way, are excitotoxins.
Okay.
So what it does is that it excites your nerve cells until they die.
Huh? That's what.
That's
That's
what some of the synthetic sugar alternatives do.
Wow.
They have what we call neurological complications.
Oh wow. Okay. Wow. So there we go. Doc, thank you for the briefing on sugar. So okay, the only good sugars are honey, honey, right? Honey, stevia. These are alternatives. And if you really want to eat sugar, then brown sugar. The less refined, the better. White sugar is just, as Doc Joel said, it's simply just poison, poison, poison. All right, okay. Doc, since we talk about sugar, a diabetic has to test their sugar levels. So if we really want to find out our true sugar level, what's the best way to test it?
Yeah, for screening purposes, aside from the fasting blood sugar, we also check for insulin level, fasting insulin level.
Okay.
So if this is elevated, it could tell me that the person's developing insulin resistance. So when you have insulin resistance, that could lead to high blood sugar. So
what kind of test do we do then for that?
Yeah, it's called the fasting insulin level.
Okay, fasting insulin level.
Yeah.
So those of you who want to find out whether you're diabetic or not, do test for your fasting insulin level, right? Because if you just test for blood sugar levels, sometimes it's just because you had a buffet or you ate too much chocolates, right?
Yeah.
So that will not give you an accurate test. All right, wonderful.
There's another one called hemoglobin A1C.
Okay.
Yeah, it tells us how your blood sugar has been for the last 3 months. So it gives us a better picture of what's really going on. And ideally, we want this at 5 or below.
Okay, so that's the HbA1c test.
Yeah.
That one will show your blood sugar level for the last 3 months. So you can't cheat yourself. You can't go fast and then have a good, healthy sugar level and say that I'm fine. I know many husbands who knows that their wife are monitoring their blood sugar level, so they will purposely fast before they take the test so that the levels are healthy. Then after that, they go eat what they want. So okay, all the wives out there, make your husband go for the HbA1c test, and that will show their blood sugar level for the last 3 months. All right, thank you, Dr. Joel. That's a very definitive way to find out whether you're diabetic or not, or whether you just had too much chocolates in the last 2 hours. All right. So next is, Doc, can you share with us about the drugs that diabetics are currently taking? What kind of drugs are on the market, and what are the positives and also perhaps the areas of concern on long-term use of these drugs?
Yeah, one of the most established medications used for diabetes is metformin, which is an oral hypoglycemic agent. Okay. It's been around for a long time. It's relatively safe.
Okay, that's good.
Yeah, but some people may get some side effects from it, usually gastrointestinal. Okay. Like they may have diarrhea from it. But again, I think it should just be part of a complete picture of treating diabetes. You can't just rely on it alone. But as far as metformin is concerned,
it's safe.
Yeah, it's relatively safe.
Or is there a limit to, let's say, metformin? I mean, why are there even other drugs for diabetes if metformin is so good?
Yeah, unfortunately, some people may not achieve optimal blood sugar control just using metformin alone.
Oh, so metformin is a safe drug, it's effective, but there's a limit to its effectiveness, and that's why there are other diabetic drugs on the market.
Yeah.
All right. Okay.
Yeah, because some people cannot achieve optimal blood sugar control on just metformin alone.
Oh, wow. Okay. So what are the other drugs that are currently on the market that are effective?
Yeah, these are what we call thiazolidinediones, which are PPAR agonists.
Yay! That's what we have in SimplyNaturePPARs, but ours is natural. Hallelujah.
Yeah, and with the PPARs from SimplyNature, you don't get any of the side effects associated with the synthetic forms of the PPAR agonists.
Wow, that's great news. Thank you, Doc. How do these thiazolidinediones work? I mean, what do they actually do for diabetic?
Yeah, basically what they do is they upregulate your plasma adiponectin levels.
Wow, there's another mouthful.
Levels.
Okay. All right. So Doc, let's move next to the actual solution part of our program. And I think in the next 15 minutes, all the listeners tune in on this. This is so important. Doc Joel is going to share how to reduce complications. What's the strategy to reduce complications from diabetes, and also how to reverse diabetes in your life. So, Doc, please share with us, enlighten us. What are the complications from diabetes, and what are some strategies we use to reduce those complications?
Yeah, first off, you want to decrease the consumption of high glycemic index foods.
Okay.
Yes, so the higher the glycemic index, the poorer your blood sugar control.
All right.
Yeah, and of course, it's important to avoid hydrogenated oils or trans fats.
Okay.
Because that could also contribute to hardening of the arteries.
All right. Because
Which
the
is quite
complication
common.
from diabetes is cardio problems, right?
Yeah. So I would also add this following supplements, including omega-3 fatty acids.
Right. Those are very good, healthy, good for your immune system. I learned that from your last video with us, where you taught us that it's important for the immune system. Yeah.
And then, of course, there are minerals that like zinc or chromium.
Wow.
And magnesium that actually could help with blood sugar control.
Wow. Okay. So zinc, chromium, magnesium. Wow.
Yeah.
If you want to know the actual dosage that you need to take every day to reduce the complications, how much magnesium you need, how much chromium you need, then click on the link below, okay, because Dr. Joel has prepared a guide for you, so that you don't have to try and remember. So just click on the link below, visit Dr. Joel's webpage and his Facebook page as well. That will also be available there. All right. So, okay. Yes, Doc.
Yeah. Taking natural anti-inflammatory agents.
Mm.
Yeah, like omega-3 is one of them, but curcumin or turmeric.
Oh, wow.
There are what we call natural anti-glycation agents.
Okay.
One example of this is something we call carnosine.
Carnosine, all right.
Yeah. Okay. Basically, what it does is that it prevents the attachment of sugar to protein molecules. Because if it does that, excessive sugar, let's say if it attaches to the protein in the eye, could cause cataracts.
Oh, okay. So that's where the complications of diabetes comes, blindness and all these things.
Yeah.
So that's how we reduce the complications. Wow.
Yes, and aesthetically too, this sugars could actually affect your collagen molecules, causing wrinkles. So if you want to age slower, avoid the sugar.
Okay, women alert. All right, you just heard the most important reason why you should not be diabetic. You will look and grow old faster.
Yeah.
All right. Okay.
And of course, the use of antioxidants is really important because there's a lot of oxidative stress going on in diabetics.
All right. So, Doc, this is how we reduce the complications. So, you've highlighted the strategy and approach. In the guide, you actually give more concrete numbers on what to do. So, everybody, remember, click on the link if this is interesting to you. Click on the link, share it with your loved ones who are diabetic or borderline diabetes. Now, Doc, let's go to the holy grail of all diabetics. How do we reverse diabetes?
Yeah, so you want to reverse it through the use of course, dietary approaches.
Okay, dietary
approaches, eating more of an anti-inflammatory diet. Basically more plant-based, less meat in general.
And just like that, we can reverse diabetes?
There's actually a doctor in the States, I forgot his name offhand, but he has like a resort somewhere in Arizona where people come in with diabetes and they go on a raw food diet for about 2 weeks. And their blood sugar actually improves once they check out.
Wow. Doc, what's your personal experience as a physician with diabetes?
Yeah, well, a lot of people do more of an integrative approach.
Okay.
So they do take their medications, but aside from that, we also treat the underlying issues that's seen in more diabetics. Like for instance, they have a lot of oxidative stress, so make sure that they take antioxidants, like improve their. Glutathione is one of the endogenous antioxidants in our bodies. It's the most powerful antioxidant produced in our bodies. However, as we age, there's decreased production of this glutathione.
Wow.
Yeah. So to correct that, orally, people could take a supplement called NAC and acetylcysteine, and that could help raise glutathione levels.
Wow. So, Doc, if you could, to reduce complication and to reverse diabetes, could you just give us a list right now? Run through a list, a quick one, maybe in just a minute or two, of some of the things that we need to look out for. So,
most importantly, you have to address the oxidative stress. So the antioxidants include glutathione, vitamins A, C, D, and E, CoQ10, and alpha lipoic acid, and bioflavonoids and carotenoids.
All right, so that's the magic list. You've got to look for that every time you are looking for a supplement when you go to the shops to get your supplements, right?
Yeah. I'd like to mention alpha lipoic acid, or ALA. It's something that's really good for the neuropathies that you see in diabetics.
For your nerves.
Nerves, yeah.
Yes.
So usually I would recommend between 300 to 900 milligrams of alpha lipoic acid per day. And that's really found to be effective in neuropathies.
Wow. So, we've covered everything. You shared the holy grail. You shared what we need to. And I'm so shocked, Doc, that to reverse diabetes is not rocket science. It's not so difficult.
Yeah, that's why an integrative approach works better than either conventional or alternative approaches. It's best to combine the two because you get benefits from both conventional and what we call complementary alternative medicine.
Yeah. Doc, I think that big take home that I saw today was that even though metformin is great, drugs can control your blood sugar, but it doesn't absorb you from the risk of all the complications from diabetes. So even and it's so pertinent now in the COVID season, right? Because you're taking your drugs, your blood sugar is normal, but you still belong to the high risk group from mortality from COVID-19 because the underlying problems are still there. You're just it's only a symptomatic approach when we take drugs for diabetes. So please if you want, go make an appointment with Dr. Joel so that Dr. Joel can advise you on how you can continue to manage your diabetes with the current medication that you have, but also at the same time, be able to reverse your diabetes and one day be off the drugs. Doc, you had something you wanted to say?
Yeah, I wanted to add a couple of things for reducing complications. So besides the antioxidants, there are natural anti-glycation agents. I did mention carnosine earlier. Other things that could help include the B vitamins thiamine, as well as methylcobalamin.
Oh, wow.
And alpha lipoic acid. And then finally, natural anti-inflammatory agents include curcumin, ginger, quercetin, bromelain, and boswellia.
Wow, that's a very exhaustive list. If you didn't catch all of that, we will have that in the guidebook in the link below. So please click on it so that you can get the full knowledge of what Dr. Joel is sharing.
Yeah, and also just to emphasize, the PPARs is a very nutrient-dense or nutrient-rich supplement. So you could actually get all these vitamins and minerals in the PPARs to help reverse diabetes.
Wow! So actually, all the things that you've listed is found naturally in SimplyNature's PPAR tablets.
Yeah.
So that's a quick way to get everything that you want naturally, not a synthetic vitamin, but a natural one. Wow, wonderful. That's great news for everybody. It's an easy way to start.
Yeah.
Great to start. So, Doc, just for our audience out there, now is a COVID pandemic. Do you do teleconsult or even group consults?
Yeah, we do online consultations.
Okay. How would our audience get in touch with you to do consults?
Yeah, they could check out my website at jlopezmd.com. Our phone numbers would be
here. Okay, there you go. It's flashed on the screen. All right. So click on the link if you want to consult, and you can reverse diabetes. So that myth is busted, and you can have a healthy life. Again, don't ignore diabetes. It's very dangerous, because if you have diabetes, it really means that you are on track to ultimately the worst scenario is that you're on track to developing cancer. So diabetes is just a precursor. So don't ignore it. It's your body telling you something. Diabetes in itself is not the most scary thing. It's hinting that you're on the road to something really horrible if you don't change. So cancer being the ultimate boogeyman, right? So as Dr. Joel advised, even if you're a borderline case, get it completely reversed. So you're not only reversing diabetes, you're reversing your risk of getting cancer. You're reversing your risk of getting a cardiac arrest. You're reversing all these things. Am I right, Dr. Joel?
You're right.
Yeah. So again, don't delay. Make a teleconsult with Dr. Joel and get to the bottom of it. Nip the thing in the bud and have a very, very healthy life, healthy and long life. Dr. Joel, any last words for our viewers before you sign off for today's program?
Yeah, once again, I'd like to thank you, and of course, Simply Nature for having me. And a lot of things are important, the dietary and lifestyle changes, but of course, spiritually, we also have to pray. That's really very important. The most important, actually.
Wow, thank you, Dr. Joel. You are right. That is the most important, and the ultimate healing comes from God. Hallelujah. Praise God. Thank you so much, Dr. Joel.
Thank you so much. Thank you.
Thank you, Dr. Joel, for that wonderful session on diabetes. I'm sure all of you have a clear idea now that it doesn't matter about your genetics. So even if you have genes that are diabetic, if it runs in your family, Dr. Joel has busted that myth. You can lead a diabetic-free life. Hallelujah. Dr. Joel also shared that you can reduce the complications of diabetes, and more importantly, you can actually reverse diabetes. Dr. Joel also shared what are the vitamins and minerals that you need in your diet to naturally reverse diabetes. And he talked about PPARs. And the good news is that almost everything that Dr. Joel specified that was required to reduce the complications of diabetes and to reverse diabetes can be found in our PPAR tablets. All right, it can be found in our PPAR tablets. Everything you see there, you need niacin, you need this, everything can be found in our PPAR tablets. So that's a great place to begin your fight and your reversing of your diabetes condition. And of course, at Simply Nature, we always encourage you to go on this journey with a doctor so that you will have someone that can guide you and will tell you exactly where you are and will be able to certify you when you are totally healed. So do use SimplyNaturePPAR tablets and soft gels to combat to reverse your diabetes, and do go to Dr. Joel so that you can get that endorsement and confirmation when you are successful with all your treatments. All right, so again, join us next time as we talk about another exciting topic that's important to you and your family. So have a great week ahead.